So when we're looking at the respiratory system, this is the basic anatomy. We can divide it into the upper respiratory tract and the lower respiratory tract. Depending on which textbook that you're reading, the larynx can be put in either of those. It's often, and I will classify it as a lower respiratory tract structure. So when you look at the upper respiratory tract, it's including the nasal cavity, because normally you should be breathing air in through the nose, and your throat, called in anatomy the pharynx. So air is going to pass through the nasal cavity, through the pharynx. It's then going to enter into the larynx, which is this structure right here, cartilaginous structure, just inferior to the throat. And after it passes through the larynx, it enters what is commonly called the windpipe, but in anatomy we call this the trachea. And this is definitely part of the lower respiratory tract. When it gets to the end of the trachea, it can take one of two paths into your right or left lungs through the bronchi. And there is an entire respiratory tree that must be passed in order to get to the actual respiratory membrane where gas exchange takes place. So we'll be going over that.